Okay, this video is Dante perspective on disease theories. Okay, so what is this all about? Well, in my car, I'm commuting to work, I'm bored, I'm reading this book about that's related to Dante. Okay, and then I'm constantly thinking about disease theories. I've gone through all the medical textbooks and they're all wrong. On all the chronic diseases from start to finish, they're all wrong. They're basically stupid. They basically just say all these chronic Western diseases are due to aging and a little bit of genetics, and nobody knows what really causes them. So why don't you take this pill to slow things down, and once you get worse, we'll do a surgery. Okay, so I'm going to go through how this all plays out, and this video is going to be largely artistic, a lot of beautiful paintings. So you might want to watch this one. If you usually just listen to them, you can do that too, of course, but I think you'll find it fun to watch it. Okay, so the first painting here is called Playing Chess with Death by Albertus Pictor from 1480, and that's in a sense what we all do. We make our move to try to keep ourselves healthy and do whatever we think is the best. So playing chess with death. And then this painting gave the idea to Ingmar Bergman in the movie The Seventh Seal to have a game of chess between the knight and death, if you will. So it was a pretty good movie, very symbolic. I enjoyed it. It was good. It wasn't great, but it was good. Okay, now, then in my Dante book, there's a scene where one of the persons who had been very, very greedy and sort of, harsh and unfair in his own way, kind of like what Scrooge was to Charles Dickens, to Dante, this greedy man was the equivalent here. And he was buried head first with his hands on his money and his feet set on fire. Okay, so what does this have to do with anything? Well, it's an interesting painting and story, but what it reminded me of is diabetic neuropathy. Okay, in diabetic neuropathy, those patients often do great going on a low-fat vegan diet. Okay, it's very symbolic, and it was related to the book I'm reading called The Dante Club. All right, so it's going to get better. Trust me, that's just intro stuff. And then long ago, I had this idea. This guy made this great book of paintings about Dante. A lot of artists have been just captivated by Dante. It's such a magnificent story. And here is Dante standing with Virgil overlooking the 9 levels of hell. And I thought, gee, this is like a metaphor for, eating the sad diet. Do you know where processed food is made? In Hell's Kitchen, okay? So the outer borders of hell are surrounded by the river Styx, filled with caffeine, okay? And there's smaller rivers filled with things like fluoride and aluminum in the water. Okay. All right. In the first circle of hell are the meat eaters, with coronary atherosclerosis. And it goes on and on. The second river of hell, Sad Acheron, filled with high fructose corn syrup. Okay, and the second circle of hell, all the diabetics with their diabetic neuropathy, arthropathy, nephropathy, vasculopathy, microvasculopathy, and dementia, leading to gangrene and amputations. The third river of hell, Cocytus, with lamentation loud, filled with oils of all the different types. The fourth circle of hell, the smokers. The fourth river of hell, Lethe, the river of oblivion, filled with aspartame and MSG energy drinks. The fifth level of hell, filled with anxiety patients. The fifth river of hell is fierce phlegethon, filled with alcohol. And then the alcoholics stagger around with pancreatitis as their injured pancreas digests itself. So it goes on. And this is magnificent paintings by Dino di Durante, an entire book of paintings about Dante. I actually bought the book. It's great. Okay, and here's just a cartoon showing, where's Big Pharma? Next floor down, and the devil's pointing down into hell. Okay, now here's a painting of Dante, with the book held out, Divine Comedy by Domenico di Michelino, 1465. And Dante standing right in the middle. To the one side is the Inferno, hell. Behind him is 7-story mountain of purgatory. And on the other side is Florence. He's been exiled for Florence, and in this sense, in this painting, it represents, like kind of like heaven, but really heaven's up in the orbs too, if you want to say that. But for our purposes, this is the path of the sad diet. Health hell is the sad diet and everything that goes with it, and the pure carnivore, paleo, and keto diets go along those lines as well. And then a person getting themselves out of health hell, they have to start heading through purgatory and getting their act together, and hopefully they'll make it to health heaven. Okay, and then here's what is it like to be a doctor in the modern world. And it's like Dante and Virgil in this boat, crossing the river Styx, and all these doomed persons. It's kind of sad as a doctor. You see all these patients, you know that almost none of them, zero, are going to get better. You can't get better from hypertension and diabetes taking pills. The cure rate for those diseases and atherosclerosis with pills and surgery, it's zero, okay? So it's kind of sad. And here's Dante and Virgil and Dante walking through hell, in this case in the ninth circle of hell. And in Dante's Inferno, he outlines why each person is there for what they did and all that. Okay, this is just one of these paintings from the 1500s, Luco Signorelli, the damned being cast into hell. And there's actually controversy about hell in the Bible. Not that we're going to get into all that, but there's some people who think that it is not even in the Bible, but there's strong opinions that it is. And, Voltaire had said, I want my doctor to believe in God so that he does not rob me. Okay. Anyways, here is the big standoff, arm wrestling between Jesus Christou and you-know-who over here. Okay. And it takes a strong person to do the right thing when there's pressure to do the wrong thing. St. Augustine had said, wrong is wrong, even if everyone is doing it. Right is right, even if no one is doing it. Dostoevsky had said in the 1800s, God and the devil are fighting for the hearts of men. Sometimes, even if he has to do it alone, and his conduct seems crazy, a man must set an example to draw others out of their solitude and spur them to some act of brotherly love that the great idea may not die. The great idea of freedom. Okay, so here's where it all begins in Dante's Commedia, with the Inferno, Purgatorio, and then Paradiso. Okay, Dante begins lost in the woods. He says, in middle age, I found myself in a dark wood, and the path was lost. And I meant to put a picture of myself when I was fat. In middle age, in my mid-30s, I got fat. I was trying to do 2 fellowships simultaneously, had a baby with the wife at home, wasn't getting hardly any sleep, working all day long. I got into drinking 7 cups of coffee. My parents got sick, and I'm like, what is going on? My father had coronary artery disease getting worse. My mother had cancer, and I'm kind of like, well, I'm supposed to be a great doctor. How come I can't even help myself, yet alone help my patients? And I went to all my doc buddies, in conventional medicine. They said, take this pill, take this pill. They really couldn't give me any useful advice. And as far as my parents at that time, I thought, oh, you just send them to the specialist. What else can any individual do? The specialist knows the most, knows best. So anyways, here's another painting of that same moment later on when some big animals started coming close. Luckily, though, Virgil was there to guide Dante. Here is the Gates of Hell statue by Rodin that is over at Stanford. And when Dante approaches the Gates of Hell, he sees the sign that says, abandon hope, all ye who enter. And I think that's a little bit like going to conventional medicine for these chronic diseases. The reason why conventional medicine calls all the chronic Western diseases chronic is because it never cures them. So you can abandon hope of being cured if you go down that path. For those chronic diseases, quite often it's for chump. So here's Dante and Virgil have now entered hell. So sort of the land of endless misery. Hell. And now actually they're waiting on the shores of the river Styx. This is the beautiful painting by Eric Music. And they're waiting for the Charon to carry them across the river. And here he comes in his boat, okay, to ferry people across the river. And I showed this painting right here of a boat going in the opposite direction, and this is what you want to do. You want to get on your boat and go in the opposite direction as fast as you can. I remember one time I dated this one girl, and she was a little crazy, and my family met her briefly, and they didn't like her. And I said, Dad, what do you think of that girl? And he says, you should get on your bicycle and start pedaling as fast as you can in the opposite direction. Okay, so anyways, here is the 3-headed dog, Cerberus, that guards the origin of hell. And it's guarding hell so the people can't get out. Okay, and the guard for hell in conventional medicine is Big Pharma. It doesn't let doctors do anything different, or they get in trouble, or they lose their license, or they lose money, or something bad happens. And it all runs on this assembly line system. So doctors are kept so busy so frantically busy that they really don't have time to have a real conversation with a patient, and they don't get paid for that. And they would be called lazy by their clinical money-minded masters if they were to spend time actually educating patients. Okay, so here I'm going to talk now about disease theories, and this is the cognitive part that people are probably going to like if they're interested in understanding disease at a sophisticated level. So first of all, you'll hear people say, oh, conventional medicine is based on science, and that's a joke. It's like some Eastern mysticism nonsense, okay? This Eastern mysticism, godless religion stuff is that the universe is unknowable, and it's kind of like Indian concept of Maya, that you can't really understand the universe. And by the way, all the stuff I'm saying is based on what I read by Indian guys. I read this book by, what was his name? All about the Bible, the book that made your world. This Indian guy. It's a great book. On the top of my head at the moment, Vishal Mangalwadi. It's a beautiful book, okay? And what he said is Indian mysticism with the idea when you start going into this Maya stuff that the world can't be truly understood, you kind of also end up what I would call the German philosopher Immanuel Kant, who said we can never know truth, we can't really trust our senses, they're too fallible. Ayn Rand described him as the worst philosopher ever. Okay, and I agree with that. You have to be able to have some objective judgment and have checks and balances whereby you can trust your senses. Otherwise, you can't know anything. Okay, and it has been said by some very genius level doctors that pharmacology is like pharmakia, like the Greek word for sorcery and witchcraft. And I remember seeing a cartoon when I was a kid of this guy, African guy going to the witch doctor, had a bone in his nose, and it was a mockery cartoon. Oh, look how stupid that guy is going to a witch doctor for a magic potion. And what I want to say is, how is that different from conventional medicine? The patient has a problem, they go to the conventional medicine doctor who gives them a pill, in other words, a magic potion. So how does pharmacology differ from sorcery? Okay. I don't know if you can make an exact copy of a chemical in the body, thyroid hormone replacement, L-Dopa to replace dopamine with Parkinson's, that's reasonable. But most of these other drugs, the public's under this imagination, and young medical trainees are also, that all these pills actually work. Medical students are trained, man, so they'll do the pill and send the bill. Okay, but you talk to the senior doctors. I got friends that have been internal medicine doctors for over 30 years, and you know what they tell me? They said, Pete, pills are poisons. These drugs don't work. That's what they tell me. Okay? So you've got the philosophies underlying conventional medicine. One is what I would call Indian Maya, that you can't trust your sentence. Another one would be Kantian philosophy. Ayn Rand described him as the first hippie, Immanuel Kant. And then, like I said, sorcery, witchcraft, and also Attila the Hun. When I say Attila the Hun, what I mean by that is Big Pharma has so much money, they can just buy off the medical centers, buy off the researchers, buy off the journals, and just force whatever they want into medical practice, okay? And only the real smart doctors will even speak up about disagreeing, but even them, they're scared to disagree because they'll get in trouble, they'll lose their license, they won't get paid. So no one ever cares what happens to the patient. So that's why I think patients tend to think the purpose of a hospital and a doctor is to help them. It is not. You need to get that out of your head or you have no hope of getting better. The purpose of those places is to make money, okay? Whether or not you're helped is largely irrelevant, okay? What you're going to get is a standard of care. And you need to know that to have a chance to navigate the system effectively, because there are some things that the conventional medical system is great at. It's great at acute care for acute problems, okay? And it is great at certain things. Okay, so what I've noticed is that, the AMA, by the way, I've heard it might be changing its name. Here's the name suggested by some persons and some of these other organizations. Here's some of their suggested names. But what I'm saying is doctors have a built-in allegiance to the insurance companies, and they have to, because they have to code their diseases in a way that they can prescribe a medication and they can please the big insurance companies. Okay, if they don't please the insurance company, they don't get paid. So a doctor has to kiss butt to the big insurance company. Doctor doesn't have to kiss butt to the patient. They'll be polite, they'll be pleasant. Most doctors behave in a polite, dopey way because so many of their patients are cognitively impaired and slow. So they always act polite and dopey until the patient, demonstrates they're able quick on their feet and they can think, and you can have a more fast conversation. Okay, but you'll notice doctors are incredibly conformist. The attitude of the doctor is, hey, I busted my butt all through college, all through med school, all through residency, all through fellowship, all through being a junior attending, trying to make partner. And so I'm not going to risk my job and my money and my livelihood for some patient, who doesn't really care and who's too lazy and who isn't going to take my advice anyways. I'm just going to do the standard of care because I got 25 other patients I got to see today. And if I don't see all 25 of them, I can't go home and I don't get paid. Okay, and I could get in trouble if they say that they didn't get the standard of care. So the standard of care is always going to be the way it is in conventional medicine. That's never going to change. Okay, and that's why doctors are so conformist to the standard of care, because it's what pays them, it's what feeds them, it's what keeps them out of trouble. Okay, we're going to get into some pretty fancy pathophysiology in a moment here, but I have to kind of build this up first. All right, so now what do I would call common sense healthcare? Based on epidemiology, clinical experience, holistic research, nutrition, and understanding of toxicology. And I'm saying you got to look at situations like the Indian proverb of 6 blind men and an elephant. Realize that when you start out, you only have one part of the puzzle. Let's say with the elephant. One's holding his tail, thinks it's a hose. Another holds his ear, thinks it's a rug. Another one holds its tusk, thinks it's a spear. Its leg thinks it's a tree, and so on. But once you kind of have seen all the parts, you can put it all together and say, that's an elephant, okay? And when you get back to philosophers, Ayn Rand's favorite philosopher, and mine too, Aristotle, okay? And he basically said, remove emotions. What does the evidence show? Recognize that you can help yourself to be free of health problems, to a large extent, quite often, okay? So anyways, free will, trust but verify, God's way of healing. Almost all of the stuff that really makes you healthy is free, okay? All right, so like I said, medical training is almost like initiation into a priesthood and a guild, and you got to follow the rules of the guild if you want to stay in the guild, okay? And versus I said, so what I'm trying to say is the allegiance of a clinical conventional doctor, MD, has to be to the insurance company, or they don't get paid and they can get their butt in big trouble. Versus what you really want as a patient is to have your healthcare provider have their allegiance to you, the patient, okay? And that's why I said the great doctors and the ones I like and I'm impressed by have an allegiance to the patient, okay? And I also think it helps that I think it's good that they have allegiance to God, in my opinion, a Bible-based worldview that man is created in the image of God, therefore intrinsically worthwhile. Because atheistic Darwinism has taken over the college system in the United States, the high school college system, grad school system as well. And what that means is that there's no such thing as a human. If you're not created in the image of God, then you're just a talking primate according to atheistic Darwinism, not entitled to anything. Okay, that's a big deal, but we're not going to go down that path tonight. All right, so now we're going to talk a little bit about psychiatric diseases. According to, psychiatrists, they basically think, disease just happens, a chemical imbalance, which is a whole bunch of nonsense, and they just put patients on drugs, okay? Nowadays, there's an incredible amount of estrogenic chemicals in the tap water, incredible amount of estrogenic chemicals in processed food, off the chart amounts. There's air pollution containing estrogenic chemicals, okay? And I think this is confusing children about gender issues. And a wise person should work through the child, the patient on that to try to help them. But what are the public schools doing? The public schools are castrating them and even taking them away from their parents to castrate them. That's insane, okay? In case anybody's wondering, that's insane. In addition, children can become very confused by the side effects of these medications like SSRI, selective serotonin reuptake inhibitors, that are commonly used to treat depression. And many articles that I've read say that they actually increase the suicide rate. And it's a neglected topic, the effect of food on mood. Many of these toxins, they're mitochondrial inhibitors, they're toxic in other ways, and also their excitotoxins make people agitated, cause insomnia. Caffeine contributes to all of that as well. Toxins in the water, things like, aluminum is a major neurotoxin in processed food. Hexane used to process soy, for example. Glyphosate being an excitotoxin intrinsically, as well as has a function of an antibiotic like to disrupt the gut bacteria and cause leaky gut, and that can contribute to psychological issues. having a lack of religion as a philosophic moral guide to help one behave better and understand the world in a more accurate way and in a way that is healthier for the person. They even have something called MAID in Canada, and that's medical assistance in dying, where what I read in an article, the article claimed that it promoted suicide even for, unhappy teenagers. Okay, that's insane. Okay, it's crazy. It's like the healthcare system doing the opposite of what it's supposed to do. Okay, and like we just said, these psychiatric companies, what happens is you get a sellout at one of the Ivy League universities who gets tons of money from Big Pharma, and they claim that, selling amphetamines is a good way to treat children who are hyperactive in school. Can you imagine if you were forced to go back to school? You have to sit in a chair for 8 hours a day. There's some lady at the front of the room who you don't know her, you don't want to know her, and she's talking about something you don't care about, and if you don't sit still, you get in trouble or labeled attention deficit. I couldn't sit through 8 hours of that. No wonder when I was a kid. I don't know, by the way, just so you know, when I was a kid, I got suspended from school for 2 years. I was put into a special classroom called a pod where I had to just be alone by myself, like solitary confinement. And what was the reason? I think the reason was I was smart. Okay, I do the homework in 5 seconds, and then I want to joke around and make my friends laugh, throw a paper airplane or do some other silliness. And so I got in big trouble. Finally, I kept getting in stupid stuff like that. My mother just told me, if you don't start behaving, you're not going to get any more rides to wrestling practice. So she said, I don't want to ever go back to that school again and have to talk to that principal about you misbehaving. I would spend days sitting in the principal's office by myself because, it was hard for me to take school, sitting there hours long, always looking out the window. Now, as a senior attending physician, I often find myself the same way, cranking through tons of work, and I'm just looking out the window, wishing I could go home, wishing I could do more of this stuff, because I could figure out lots of these diseases if I just had more time to read. Okay, so anyways, getting back to these diseases here. If you sold amphetamines to an adult on the street corner, that would be illegal. Okay, but you can sell amphetamines to children? It's insane. All these drugs, like the drugs used to treat major depressive disorder, schizophrenia, and anxiety drugs, they produce a gradual onset lobotomy. Okay, it's insane. All these psychiatric drugs, insane. The long-term data, take a look at it. You'll be amazed at how bad they are. Okay, then we talk about obesity. You go to a conventional medicine clinic at the famous universities. I actually went through one just within the last 6 months. And, they tell you nobody knows. Don't ever fat shame a patient. A lot of it's genetic, idiopathic. And they've got major carbophobia, thinking carbs are the problem, okay? Carbs are the answer. It's kind of like Zsa Zsa Gabor. Some women think men are the problem. I think they're the answer. Anyways, they all recommend like a high-fat version of the Mediterranean diet. It's complete stupidity. And then they said they should be giving more of these weight loss drugs, the Gila monster toxin. And then they say that they should be doing more bariatric surgery. Brilliant, okay? Why not teach people what causes obesity? Eating a high-fat diet, high fructose corn syrup, estrogenic chemicals, lack of dietary fiber, lack of sleep, excessive psychological stress, elevating cortisol. Okay, atherosclerosis. The atherosclerosis. What I'm doing right here now is just showing you that the conventional medical textbooks are a joke. They're wrong on all the major stuff. They're wrong about obesity. They're wrong about psychiatric disease. They're wrong about their entire philosophy. They're wrong about atherosclerosis. They're going to teach some bogus, childish version of cholesterol theory, okay? Oxidized cholesterol. And then you have all these guys trying to sell more drugs. You have the Harvard doctors trying to tell you that atherosclerosis is due to inflammation. You need to take drugs for inflammation. Well, if it was due to inflammation, how could Esselstyn cure it with just diet? Okay, diet's the main point. Okay, if you can cure it with just diet. There's a whole bunch of other doctors trying to say it's due to bacterial infections and root canals and stuff, and you need antibiotics and these other issues. Well, if that was the problem, how could you cure it just with a low-fat diet? Okay, that's not the cause of the problem. And then we're going to get into another concept on disease. Are the bacteria in the blood, are they causing an infection, or are they dormant, and are they scavengers? Atherosclerotic plaque, by the way, is a blood clot. So once you study atherosclerosis, and by the way, I did a fellowship at Harvard in imaging-guided surgery with the emphasis on atherosclerosis. I've been interested in it for over 30 years, and I'm actually friends with like one of the best, actually the best researcher in the world on atherosclerosis, okay? I put a lot of time into studying. It's a blood clot. Okay, once you understand that atherosclerosis is a blood clot, and you understand hemorrheology, the concept of blood viscosity, thick blood when you're eating a high-fat meal versus thin blood when you're just eating a normal low-fat meal. Makes a big difference. The thicker the blood, the higher the blood pressure has to be to pump it through the circulation. The higher the blood pressure, the more it damages arteries at branch points and causes blood clotting, which is an atherosclerotic plaque. Okay, so atherothrombosis is the all-encompassing theory of atherosclerosis, the one that makes sense, the one that I see every day. Okay, cholesterol is very important because elevated LDL cholesterol is the main bridging molecule that makes red blood cells stick together. Okay, red blood cells normally don't stick together because they have a negative charge on their outer surface called the zeta potential. By the way, for each of these individual topics, I've got detailed lectures, an hour or more of lectures, quite often multiple lectures on these topics. But what I'm doing with this one here is I'm showing you how the conventional medical books are stupid from start to finish. People think, oh, these doctors are so well educated, they're so smart, it's so hard to get into medical school. What they don't realize is it's a big game, okay? And what the medical students are chosen for, they do have to have some intelligence, they do have to have a good capacity to memorize stuff, okay? But the stuff they're educated on, it's irrelevant, okay? What do you learn in pre-med? Physics, okay, calculus. I can tell you that, I'm a triple boarded Harvard trained doctor. I don't ever use any math that I didn't know by fourth grade or third grade. Okay, math is irrelevant. I don't even think people should be taught that much math after eighth grade. It's a big joke. Okay, you don't need it in real life. Why waste all your time doing that? Okay, they should be learning debate. Okay, how to pick apart logical fallacies. All right, well, anyways, then what else do you learn in med school? You learn physics. Okay, again, it's irrelevant. I don't ever use any of that stuff. And I'm in the highest tech fields you could be in, imaging guided surgery, and I'm a neuroradiologist. These are very high tech things, okay? Even though radiologists have to take a boards exam in physics, it's a joke, okay? It's just a guild barrier. We don't ever use that stuff in clinical practice, okay? It's just so we can say we are trained in physics. All right, well, anyways, getting back to this, fatty liver is like all of the fat Western man diseases, okay? I see fatty liver numerous times every day. The majority of American adults over 50 have fatty liver. It's basically prediabetes or diabetes of the liver is a good way to think of it, okay? It's an indicator that the liver is no longer accurately able to sense the blood glucose level, such that it'll tend to keep on running gluconeogenesis and pumping glucose into the blood, causing the person to be chronically hyperglycemic, having high blood glucose levels, including in the fasting phase, okay? All right, and I recently saw some really famous, I'm not going to say his name, but really, really, really famous carnivore diet guy had a fasting blood glucose over 126, and it was consistent with him being diabetic. Okay, let's see, what else here? We talked about fatty liver, how super common it is. If I ever hear elevated liver function test, 99% of the time that means fatty liver. It could mean other things, I'm aware of that, but that's what it means 99% of the time is fatty liver, okay? And we know that, why not look at the dietary causes? Excessive dietary fat, high fructose corn syrup, estrogenic chemicals, glyphosate on processed food, alcohol, all right? Diabetes type 1, okay? Nobody knows what causes it in conventional medicine. Okay, they just get the patient on insulin, okay? And you have to treat them with insulin, but you can at least be aware they might have some residual pancreatic function, that they should avoid dairy, which seems to be the main cause of it, with, molecular mimicry, leaky gut, autoantibody cross-reactivity, and all that. Okay, diabetes type 2, that's the fat man disease, okay? And it just starts plugging up all their arteries, and most of them die of coronary artery disease. But we know the things. I've given entire lectures on what causes diabetes. And we know that low-fat, low-sodium vegan diet is the way to go, but you won't learn that through conventional medicine. You won't learn that through the American Diabetic Association. Actually, the American Diabetic Association is getting better than it used to be, and it's working more towards promoting plant-based diets and stuff, but it still ain't as far as it used to be. I remember years ago I thought, well, gee, I'm going to go to the grocery store and I'm going to look at the food for diabetes. That has to be really healthy because those are fragile, sick people, and they're going to feed them good stuff. And it was all this junk food. I couldn't believe it. And I went and I met with all the endocrinologists. They don't know anything about diet. They don't know anything about diabetes causation. I'm not joking. All right. They hadn't read any of the landmark papers in their own field. That's what I meant by when I was young, I thought you go to a specialist because they really know their field. Actually, that's not true. Quite often the specialists, they don't know anything in their field other than how to diagnose a disease so they can generate a billing code for insurance companies and get paid, and then what are the drugs for treatment. And that's nice, but Wouldn't it be nice to know what actually causes the disease when it's due to something in diet or toxicology and then avoid that thing? That would be optimal care. So there's a big difference between standard of care and optimal care. Sometimes they're the same thing. They're the same thing for a lot of stuff, okay? But for all these chronic diseases, they're very often not the same thing. But the patient's going to get standard of care. So you as an individual, for yourself, for your family, for your friends, you should want optimal care. Okay, hypertension, all the books will say unknown idiopathic genetic, but as soon as you look at, the epidemiology, plant-based communities that don't add salt to their food, they don't get any hypertension. It's like next to zero. There's some really rare causes of hypertension, but just to give you a little sense of how rare these causes are, the things like a pheochromocytoma tumor of the adrenal gland. I've been a doctor over 30 years. I've seen 2 cases of that. Okay, what do you see? Hypertension. You see it all day long. The majority of the patients have hypertension. So that's so rare it's not even funny. And then you say, what about renal artery stenosis? Renal artery stenosis is really rare that it's the causative lesion and that it's fixative, okay? That you can just pop a stent in there and cure it. Yes, sometimes you can, but that's uncommon, really uncommon. Okay, what else? Eye diseases. You can call them idiopathic due to aging, all this other stuff. But the fact of the matter is, Kempner just cured tons of these patients, putting them on a low-fat, plant-based diet. All right, and they're all vascular. Dog. Okay, that's my mnemonic. DAHG. Diabetes, age-related macular degeneration, hypertension, glaucoma. Okay, what else? Autoimmune disease. You read the regular textbooks, they won't even tell you. Entire, new textbooks of pathology written over at Harvard, and they don't know anything. They're stupid. That's why I say, the chief of internal medicine at Harvard, in my opinion, is a little better than a clown from the 1750s recommending a phlebotomy on most of his patients. Okay, drug-based medicine, it just doesn't work, and that's why all these diseases are called chronic, because they can't cure them. Meanwhile, you look at the plant-based community, the low-fat vegan community, and they cure tons of patients. You got all this cure after cure after cure. Now, not everybody gets cured. Some patients don't get cured. And sometimes it's other things besides leaky gut. Rarely. It could be toxins. It could be things like F-. It could be related to GP. And there's a few other tricky little things in there. You can get xenocellulitis from eating meat as well. Okay, and there's a few other tricky little things in that can get into this game, all right? Amyloidogenic clotting can cause, and that's related to leaky gut, but for a different reason, with release of bacterial endotoxins like lipopolysaccharide, LPS from the gram-negative, LTA, lipoteichoic acid from the gram-positives. And in that context, what you're talking about is these hyperthrombotic disorders. And these hyperthrombotic disorders are a big deal. They can be post-infectious, they can be post-viral, and they can also just be due to old-fashioned leaky gut for whatever the reason, lack of dietary fiber. But they can start forming little clots all over the body and cause a lot of problems, okay? And you don't have to have a big vessel occlusion to have coronary problems. You can have microvascular angina from occlusion of small vessels. Okay, so what do you want to do? Remember the words of the English poet John Dryden, I am wounded but not slain. I will lie a while and bleed a little and then rise to fight again. So how does one climb out of Plato's cave, out of this nonsense that you just have to, the center of the health universe is taking drugs? Nobody has a dietary deficiency of drugs, okay? If you see the light of low-fat veganism, look at this beautiful painting, Sadak in Search of the Waters. Okay, this is by John Martin, 1812. It's a beautiful masterpiece. You can see Sadak here is climbing his way up the hill. When you first start, climbing yourself out of a ditch, it's pretty difficult, okay? And to make that initial transition, you feel kind of funny the first 2 weeks going from a meat or a sad diet to a vegan diet. But as you progressively get past that, it becomes much more pleasant and joyful experience, and it's kind of a little bit like the old quote. I think it's Winston Churchill. I'm not sure, but it's like, what do you do when you find yourself going through hell? You keep going till you're out. Okay, now here is... this has sort of been called the war in heaven between, the fallen angels, the devil, and the good angels, if you will. And this is basically all the things that take you to health heaven, and here's all the things that take you to health hell. High-fat diet, animal protein, all these toxins, mitochondria inhibitors, SERCA inhibitors, all this stuff here. So this is another nice painting by Ruin. Okay, now we're getting into some more John Martin paintings, kind of cool stuff. And this is like the Fallen Angels, like Paradise Lost. Paradise Lost, I actually enjoyed reading it. It's a little bit difficult to prose. I had it sort of translated into modern prose. And when you read that version, it's kind of a cool story. I got it on my bookshelf somewhere. I actually really liked it when I read it that way. I understood why people liked it. It was actually good. Okay, here's more paintings by John Martin. Again, like from Paradise Lost, Pandemonium. Pan means all, demonium is demons in hell. So all the demons in hell. Okay, so these paintings are kind of scary. And here they are meeting. This is Satan presiding over his infernal council. This is sort of like Big Pharma meeting with all the insurance companies. How can we take some more money from these stupid proles? How can we empty out their wallets and fleece these dummies, these useless eaters? How can we get them to disappear faster so we don't have to pay them any pensions? Wouldn't that be? Then we don't have to pay them Medicare. Isn't that what they want? And we can just replace them, open up the you-know-what. Okay, anyways, getting back to disease theories. Diverticulosis, okay? If you go to conventional medicine, they go, well, nobody really knows. It's idiopathic. It's partly genetic. And, ain't no sunshine when the fiber's gone. It's due to a lack of fiber. The person's constipated, straining at the stool. It's called Valsalva maneuver. And the back pressure causing outpouching of the sigmoid colon. That's diverticulosis. And sometimes the thing pops and you leak stool into the mesenteric fat, peritoneal fat. And that's diverticulitis. Itis means inflammation. Okay? And then GERD, gastroesophageal reflux disease, typically a hiatal hernia. I mean, the stomach pops into the chest part of it, and you leak stomach acid in there, and it causes inflammation, heartburn symptoms. And the point of all this is Dennis Burke has figured all this stuff back out around 1960, abdominal pressure syndrome. Conventional medicine doesn't know that, okay? I talk to surgeons. They don't know that. I teach them this, okay? I've had all these young doctors that come around, they go, oh, wow, you just explained everything. Yeah, no shit, okay? And that's what pissed me off, too. I was first in my class, 99 board scores. I studied so hard, I basically gave up my life. My whole life, ever since I was 18-year-old, has been studying. I want to go back to a fun life like I had in high school, but it's always like God says, nope, you're going to work. You're going to work. Your job is to be a scholar and a worker. No more goofing around for you. I didn't choose this life. It just happened. Okay, so anyways, that's abdominal pressure syndrome, which explains about half of all abdominal disease, and leaky gut explains most of the rest of it. And there's a few other things, but it's about 90% of abdominal disease right there. Okay, toxicology. And the other thing, now toxicology, man, doctors don't know anything about this, but it's so important. If you got to know the toxins so you can avoid them. Okay, the typical doctor has been brainwashed by all these lying high-fat phonies that promote all these toxic commercial foods. A lot of these so-called vegans you see on the internet, they are not working for you. They're working for industry. I can tell you, I see them. They're promoting coffee and tea and caffeine and olive oil. Doctors are not your friend. They're not helping you. Maybe it's because they're ignorant. Maybe it's because they're stupid. But a lot of times too, maybe they're paid off by industry. Okay. Because somebody who's intelligent should know all the problems with these foods, okay? And MSG. How could anybody say that MSG is okay? It's a proven neurotoxin, excitotoxin, and that's been known very well since the 1960s in the work of John Olney. And the problems with that's only been expanded. But the sad truth is that it's no longer the main problem in terms of excitotoxins because nowadays the companies, they don't need MSG. They can just manufacture free glutamate, 10 times easier to produce tons of that into food, okay? So anyways, what I'm saying is doctors don't know anything about these things, and like I know these things and I talk about them. Most of the other nutrition experts on the internet, they will not talk about these things, and the reason is you pay a price. Whenever a video maker on YouTube makes a video about toxins in food, on these popular commercial foods, that video gets far fewer views than you would expect. It always gets hidden some way. And like when you try to search for it, you might not see it. When it pops up, initially if something is going to be promoted, when it pops up on the first search screen or the first sign-on screen, it'll show how many views on it. There'll be things done to encourage it, put it in a prominent, visible position, versus when they don't want that thing promoted, you can't find it. It's like 10 times as hard to find, you know? And like you start typing it in, the popular thing they want you to find, and it'll auto type itself to make it easy for you to find it. On the other hand, if you're trying to find something that they don't want you to know about, you can type it in, you misspell one letter out of 20, you won't be able to find it. So it gets hidden. All right, so the next big thing is screening. Screening is a giant trick by big medicine to just turn the average chump into a patient. And screening is one of the most bizarre things. All these patients think it's a great thing. Patients think they're, like going to play the lottery and they got a chance to win big. They don't understand screening at all. Like I said, I've been doing screening over 30 years, and all I see is, yeah, once in a blue moon rare, you'll see some patient that really benefited and was so-called saved. Every day, you'll see tons and tons of false positives, incidental worrying the patients, making them putting their life on hold, making them postpone moving, marriage, and you name it. And then they have to empty out their wallets paying for all these follow-up CAT scans and MRIs. And sometimes they actually get made sick by it. If you got some turtle of a prostate cancer and you get your prostate surgically removed, I've seen a lot of guys in chronic pain from that, impotent from that, urinary incontinence from that. You know what I think of PSA? I'm never going to check mine, okay? I'm just going to do the things like Ornish's study showed, and even more than that, and minimize my risk, okay? And that's actually what a lot of smart people do, and I think it's the smartest option for the guy who can trust himself to do it, and I trust myself to do it. If you don't trust yourself to do it, then, be a chump. Go get 12 needles stuck up your butt. Have fun. Okay, so anyway, screening is like one of the most overrated things in all of clinical medicine, but patients love it because they're so ignorant. They don't understand what it's really about. Okay, let's say you get the free test, the first one free. What about the follow-ups? And there's a lot of them. Okay, the other thing, typical thing going on nowadays is TV commercials for drugs to the lay public. And they don't really know what they're looking at. And it creates a mindset that the answer to a health problem is to take a drug. Okay. Same old story, match the ill to the pill and send a bill. Okay. What is dentistry? Drill 'em, fill 'em, and bill 'em. Okay. And like I said, the docs, they're not trained in diet. Even the dietitians are not trained in diet. Big Food has bought out like a lot of the funding for the educational programs in these dietitian schools. And these dietitians, most of them, don't get me wrong, I know some of them are really good, but most of them, all they do is recommend stupid stuff like Mediterranean diet, high-fat Mediterranean diet, keto diet, all this stupidity. Infection. Okay, one thing about infection is you should know about the terrain theory. Okay, everybody knows germ theory. Everybody knows about Pasteur and pasteurization. And there is some usefulness to that, okay? But you really want to know terrain theory. It's greatly underestimated. The idea of if you just make yourself healthy, manage your stress, lower your cortisol, your body has tremendously increased resilience to fight infections. That's what you want. Other things, and by the way, I like infectious disease. I know some of them who are really nice. I'm friends with them, okay? But I am going to say that their education, like most internal medicine specialties, is stupid, okay? If you ask them, what about dormant bacteria, they'll look at you like, why would you say anything so crazy and stupid? But you can point out to them in 2 seconds, this is well-known, obvious stuff. Everybody knows mycobacteria tuberculosis has like a dormancy phase. Everybody knows syphilis, tertiary syphilis has a dormancy phase. Lyme disease has a dormancy phase. HSV, herpes simplex virus, has a dormancy phase and can all be reactivated. And then there's a bunch of other bacteria, and some bacteria live intracellular, etc., etc., etc. Why wouldn't you be more in tune with this idea of dormancy? It's a big deal, okay? And we actually have dormant bacteria that live in our blood. And when we have elevated amounts of free iron, they are reactivated because they need iron to replicate. And in that context, they can release LPS, lipopolysaccharide. The gram-negatives, the gram-positives can release LTA, lipoteichoic acid, and that can cause a lot of health problems. First of which, it'll be they're hyperthrombotic, and we talked about that. I gave previous entire lectures on the concept of LPS-induced amyloidogenic clotting, meaning that it causes an abnormal type of blood clotting that's much more disorganized and hard to lyse, meaning those clots are harder to dissolve because the body is always forming little tiny clots and dissolving them very quickly. It's well designed to do that, but these clots are more resistant and then they're more likely to travel and plug up some small vessel in your brain or your heart or other parts of your body. Okay, so that's a big topic. Okay, reactivated bacteria due to free iron elevations, and also, the free iron can auto-catalyze oxidative stress and the Fenton reaction and the Haber-Weiss reaction, for example. Okay, musculoskeletal problems. Now, musculoskeletal problems, a lot of times they can be due to ischemia, lack of oxygen delivery due to high-fat diets and high-sodium diets. Generalized inflammation from eating a meat-based diet for multiple reasons, not the least of which is insulin resistance, as well as xenocellulitis and other problems, tissue ischemia. And so what do they do for arthritis patients? Typically they treat them with pills, and then eventually they'll do steroid injections in the joint, and then eventually they'll do joint replacement surgeries. And I've seen some pretty significant problems from knee replacements. I've seen some people have successful knee replacements. They're still doing okay 10 years later. But I've also seen people I've personally known die from knee joint replacements. I knew a really famous spine doctor who, had numerous infections with staph, had to be in the intensive care unit like about 4 or 5 times, had to get a redo on his knee surgery. It was a big mess. Okay, so what's the point? McDougall wrote a nice essay, the only hope for arthritis is diet, okay? And don't get me wrong, you can do a lot with diet. Yeah, physical therapy can help some, and there's some other things you can do, but if you optimize the diet, low fat, low sodium, you optimize blood flow to the joint, you have the best chance to heal. Also, I forgot to mention diabetic neuropathy. A lot of it is ischemic, and when you improve blood supply to the nerve, you often get a dramatic reduction in pain. And there's plenty of articles published about that. Okay, I've just recently, wrote an entire book and went through many of the chapters on it. The whole beta amyloid Alzheimer's theory is a bunch of nonsense. I explain that in the book. If you really want to understand dementia, the 2 most important theories, you should know the Jack Delatour theory, vascular hypothesis of dementia, I call it the mouse equivalent theory of chronic cerebral hypoperfusion. That makes sense, and you can do things to avoid it. And you should also avoid overtreating hypertension and avoid eating a diet that causes hypertension in the first place. Because those same diets lead to valve disease in the heart, like aortic regurg, aortic stenosis, aortic fibrillation, that all cause aortic fibrillation being a conduction abnormality. And then my theory of brain dementia causation, the neurovascular uncoupling theory. If you take stimulants and excitotoxins, they elevate your metabolic rate, as well as if you do other things to elevate it, stressed out, caffeine and whatnot. And then if you do things that drop your metabolic, your glucose oxygen delivery or your mitochondrial ATP production, your energy production basically, you're going to lose a lot of neurons from apoptosis. Although there's tons of mitochondrial inhibitors. I went through all that. Lots of SERCA inhibitors, sarcoplasm, endoplasmic reticulum, calcium, ATPase. You need lots of ATP to pump calcium out of the cytoplasm. And so if you don't have the ATP from good mitochondrial function, can't do it. If your SERCA enzymes aren't working, those pumps aren't working to pump calcium into the endoplasmic reticulum, you can't get that calcium out of the cytoplasm. That nerve is overactivated, and it's going to need tons of glucose and oxygen delivered to keep up with those energy demands. Okay, what else? Strokes. The amount of strokes that are successfully treated with transcatheter thrombectomy or TPA, they're minuscule. It's less than 1%. So while, it's a beautiful thing when it actually happens, it's rare. I can tell you, for example, during my fellowship year, we had 2 cases successfully treated with transcatheter, thrombectomy or thrombolysis. Okay, 2 out of hundreds of thousands. Okay, so don't think that that's the answer to preventing stroke. Okay, if you eat a low-fat vegan diet, and you don't smoke cigarettes, you don't add a lot of salt to your food, your risk of having a stroke is next to nothing. And you avoid insulin resistance. You can get strokes from diabetes. You can get them from hypertension. So those are the things you want to avoid: atherosclerosis, hypertension, diabetes, obesity. Okay, what else? Spinal degeneration. Yeah, the main thing causing spinal degeneration is ischemia, lack of oxygen supply, and also F- in the water, GP in the processed food, and I think AGEs are contributing to that as well, advanced glycation end products associated with diabetes. Okay, all of those things are totally avoidable. Okay, it's not just aging in some random mystery. Okay, abdomen. Okay, I already went through abdominal pressure syndrome. For cancer, the typical way MDs are taught about cancer is SMT, somatic mutation theory, and sometimes it is relevant. There is such a thing as mutation, and there are certain mutagens that increase the risk of that. But the reason I'm mentioning it here in this context of going through theories is that by far the main reason for cancer is the metabolic theory of cancer. The somatic mutation theory has been largely just proven by the Genome Atlas project. Okay, they didn't find a systematic, predictable stepwise pattern of mutations, almost never. So, anyways, metabolic theory of cancer is very useful, and once you understand it, it tells you all the things you can do to start protecting yourself, like low fat, low sodium, vegan diet, get your sunshine, lower your stress, etc. There's some more. I've given tons of lectures on that. We're not going to go into all those details now, but so basically, I just went through most of the common chronic diseases, almost all of them, and I explained how they're caused primarily by diet, lifestyle, and toxicology, and that stuff's avoidable. So just getting back to Dante, here's Dante, exiled from Florence, quite alone, quite sad, and you'll notice a lot of the greatest books in the history of the world have been written by exiles. When a person's exiled, they've got some time to think, okay? And when they're out of their home element, because they've got their original perspective and now they've got the new perspective, they can see things in an objective way. And so you'll often see that with a lot of great books. Cicero, the great Roman, greatest of all Romans, was exiled to Greece, and he wrote some magnificent books, okay? If you think about other exiles, they've written great books, Voltaire, when he was exiled to England, okay, he wrote the English letters, and there's lots of other examples of exiles, and people often feel exiled when they're alienated from something. I myself feel a bit alienated from conventional medicine. I'm a bit of an exile from conventional medicine, okay, because it failed me, it failed my parents. All right, here's Dante, and he sees Beatrice. So Beatrice was sort of his childhood love. And then later they kind of had to go their separate ways, unfortunately. Look at the beautiful bridge, in Florence. It's magnificent. Okay, and I can identify that. I'm sitting here cranking through all these billing codes at work, and I'm looking out the window thinking of my love from when I was young. Okay, Dante the writer in exile. And here he was, not a lot to do. He's in exile by himself. Good time to write. So, they talk about it's no fun being exiled. I was exiled from my high school life when I went away to Stanford. I was originally from far, far away from the Midwest. And so being out there, I didn't know a single person, but it made it good for studying because I had nothing else to do. So I got good at school because I had a lot of time to study. No distractions. So here is Virgil and Dante walking on the ledge through one of the levels of hell. There's 9 levels of hell. Magnificent painting by Eric Armusik, and this other artist here, Gabriel Dallotto, an Italian artist, made all these beautiful paintings of the whole Dante Divina Commedia story. And here again, they're walking through the different levels of hell. And the worse your sin, the lower the level of hell that you're in. And just to let you know, too, I know some great Bible scholars who I read who claim that there is no such thing as hell, that it's not really in the Bible, and no loving God would send people to hell for eternity, and other people saying that was written into the Bible, but that it's necessary, otherwise you can't motivate people to be good. So just so you know that there's all those different points of view on it, and we're not going to get into that right now, but be that as it may, Dante continues, and he has a vision of Beatrice and the hope that she might lead him. He's gone through hell and the inferno. He's gone through purgatory and the idea that she might guide him to heaven. And he does help Virgil to become a Christian so he can be, taken in and go to heaven also. And Beatrice is going to guide him so he can see what heaven is like, a mere mortal. Beatrice and Dante look up to see the heavens. This by Eric Armusik, great, beautiful painting. And then here, Beatrice is now guiding him to heaven, okay? And man and a woman are happy together, man. When you're with the woman you like, man, that's about as good as life gets. Okay, so anyways, beautiful painting. Isn't it just magnificent? And now here is Dante and Beatrice, and they're at the gates of heaven with St. Peter in this painting here. And here's the vision of Dante, waiting in line next to heaven by Cristobal Rojas. Just beautiful painting again. And so now you know the path out of hell and all these chronic diseases. Not all of them. I can't give you a guarantee that every single disease will be curable by this, but I can say you'd be better off than if you didn't have this. And if you add in all the other little details that I've talked about in all my lectures, all that neurovascular uncoupling stuff, that EMF stuff, all that toxicology stuff, you got a better chance. So here's this young lady looking up at her stairway to heaven. And here's all these old ladies, saying their prayers and taking the stairway to heaven. Nice painting there by Alessandro Dona. And here is, hopefully for you as well, someday, Stairway to Heaven. And that's the end. I hope that was helpful or interesting or enjoyable. I liked the art. I thought it was kind of fun.